Welcome, everyone. My name is John Hancock, and I am the Associate Dean of Students for Health and Wellness at Lewis and Clark College. I also function as Chief Psychologist at the college. It's so great to have you all with us this afternoon for our webinar on Student Health 101, Resources for Student Wellness. We have a number of panelists who are going to give you an overview today of some of our wellness resources on campus. I know that we continue to live in a time when COVID is among us, and we want to especially offer some resources and supports so that you're aware of the good planning the college has been doing around COVID to bring our students back this fall. So we've got some great panelists with you today. Henry, if you will show slides and advance slides, please. Just want to be sure that our slides are showing as they should. Give me just a moment here to work with Henry on that. Okay, there we go. Thank you, Henry. Henry is our person behind the scenes today who's kind of coordinating the technology of today's program. So these will be our presenters today. Lots of years of experience at the college. I want to acknowledge today's session is being recorded. So it will be posted within about 48 hours on the new student orientation website. So if there's anything you want to re-listen to, or folks who can't listen in today and they want to listen at a different time, they can listen to that recording. Originally, our program today was scheduled for an hour. We have a lot of content to cover, so I think we're probably going to go a bit longer than an hour. We want to make sure that we give you the information you need, and we will have some time at the end for questions today. So if you do have questions, feel free to propose those to us. You can use the chat function to do that, and then we will address questions primarily at the end of today's presentation. Henry, if you'll advance the slide, please. So I thought I might start by talking about three key resources that we want you all to know about. The first is the college's COVID website, and the college did recreate that website. It was launched about 2 weeks ago. There's lots of good information there about our policies and practices and procedures and resources for the fall. So I encourage all students who are coming in this fall to check out that website, and for family members to check it out too. If you'll go to that website, you'll also find that there is quite prominent on the website a case reporting link. So throughout this academic year, we will be reporting case data through that website on that special web page there that you can find. So if you ever are curious about sort of what our case numbers are looking like on campus, you'll be able to see the case data on that web page. And then finally, hopefully you all know about our COVID response email, COVID-19 info@lclark.edu. So that's a great resource to have after this presentation. If you have any COVID related questions, that's the best place to send those. If you'll advance the slide, Henry. So, you know, we are super excited to welcome students back this fall. We offered in-person classes throughout last year and are excited to be at a place where we can continue to do that. And we continue to watch the evolving situation with the coronavirus. Our executive and administrative staff, our health staff, looking at community transmission rates. It is challenging. You know, the last point on this slide is that our commitment is to remain flexible. Our flexible approach to the pandemic is what allowed us to be so successful last year. We had very low case counts on campus last year, very low test positivity percentages. The test positivity percentage for last year, for last spring, was about 0.2% of all the tests that we administered. And for the fall, it was very comparable to that. So, so we did a really good job last year, and our key was remaining flexible. We're going to remain flexible this year too. We study what's happening in the community. You know, we are very tuned into the news about the Delta variant, what's happening with that. We believe that our vaccination policy is one of the key things that will support our community. We will have an extremely high vaccination rate among our community this year. We are allowing for students to claim religious and other exemptions, but even so, we'll have a very, very solidly vaccinated population, and that is our best source of resilience against the threats that the virus faces. So we are excited to bring students back and to support them as they re-engage with their studies this fall. Next slide, Henry. So some things I want all of you to know about as you support your students. August 1st was the deadline for students requesting exemptions. So just so you know about that, August 15th is the deadline for students to document proof of their COVID vaccination via the health information portal. So if your student hasn't done that yet, please work with them. It's a two-step process. They've received information about this on multiple occasions. We still have some students who haven't uploaded their documentation, so please support your student in doing that. Please be aware that residential students will not be allowed to move on campus unless they've either documented proof of COVID vaccination, or they've had an exemption approved, or they're actively working with our wellness staff in the above directions. We know, for example, with our international students that some of them haven't had access to vaccine. It's possible we could encounter some domestic students in that same situation, although it's much less likely. If students are actively working with us to get vaccinated because they could not access vaccine this past summer, we will work with them. But we really do expect our students to return to campus this fall fully vaccinated unless they have had an exemption approved. Once we get to September 15th, for our undergraduate students, they will not be allowed to attend class after September 15th unless they've either had proof of vaccination uploaded or had an exemption approved. So that is sort of the final deadline in terms of class attendance. And just a final note that unvaccinated students are expected to show results of a molecular COVID test. Oftentimes people use the word PCR. It's not exactly interchangeable with the word molecular. There are some molecular tests out there that aren't PCR. So we're requiring results of a molecular COVID test within 72 hours of arrival on campus. And unvaccinated students will also be subject to surveillance testing this fall semester. Next slide, Henry. So one of the ways that we get really excited here at Lewis and Clark about welcoming students back is our Parent and Family Preview Program. And so we will have that again this year. And we're looking forward to meeting lots of parents and family during that program. Please know that in addition to the requirements for vaccination that students will need to show or exemption, students will be sent some information in the very near future about an educational module that will reorient. It will reorient our returning students, but it will orient our new students to what the public health expectations are around COVID on our campus. Students will have to complete the module. They'll also have to take a pledge to uphold the public health standards of Lewis and Clark in addressing what we really need to do as a community to respond to the threat of COVID. So students will receive that information soon, and they will have to complete that module and that pledge prior to checking into the residence halls. Please also know that symptomatic students, if they're moving into residence on campus and they are symptomatic on the day of move-in, they will not be allowed to move in until they have received a medical evaluation and testing. So please be mindful of that. We hope no one is sick on their day of move-in, but we really want everyone moving on campus to be healthy, and we really don't want COVID to get any sort of foothold on campus. So if a student is symptomatic, we will be referring them for medical evaluation and testing. Also, in terms of parents and family members themselves, we will be asking them to wear a mask for parent and family preview programs when they're indoors or when social distancing is not possible. If a parent and family member wants to share their vaccine with us, and share their vaccine status with us, and that's totally a choice for them, whether they do that or not. But if they want to offer that to us, we will provide an opportunity for them to share that with us when they are checking in that day for parent and family preview. And if they share that with us, we'll give them a wristband so that they can go without a mask on campus in or spaces. Now, I say all of this, and this is our current plan. We are watching, again, the situation with the virus. And so these pieces around students coming back and parent and family preview, may be subject to change. But this is our best guidance at this point, and I think it's very strong and solid guidance. So that's where things stand at this point. So hopefully that gives you a sense of what to expect as you help your students return to campus for parent and family preview. I'm now going to turn it over to someone else on my team, Ami Hanna, who is our health promotion coordinator and COVID-19 specialist. If you could advance slide, Henry.
Thank you, John. Hi, everyone. My name is Ami. I am, as John said, the health promotion coordinator and COVID-19 specialist for the college. You can advance the slide. So I just want to touch a little bit on some of the prevention efforts that we're engaged in at Lewis and Clark. It actually starts before your students even come to campus. We do ask that students who are preparing to move in bring the following items with them to campus: a thermometer, more than one well-fitting face coverings that they can wear over their nose and mouth. We recommend that students have fever-reducing medication on hand, something like an aspirin, an ibuprofen, and then other supplies like facial tissues, hand sanitizer, and disinfecting wipes, just covering the basics. Next slide. Thank you. All right, so we also ask everyone who is part of the Lewis and Clark community to engage in self-monitoring, including those who are vaccinated. So we want everyone to be self-screening for COVID-19 symptoms every day before they come to campus or they leave their residence. We ask that students stay in their residence if they have COVID-19 symptoms. So a full list of the symptoms that we want students to screen for can be found on the Lewis and Clark COVID-19 response webpage. They can refer to it every day just to kind of do a self-scan. But broadly, we want students to be looking out for symptoms like coughing, fever, chills, shortness of breath, head and body aches, loss or taste of smell. And then we have them report those symptoms if they should appear. And I'll tell you how to do that on the next slide. So we have a reporting system that we ask students with COVID-like symptoms to engage in. So first of all, we ask everybody to self-isolate in their residence following the college's guidelines for self-isolation, which are posted on the website and updated regularly. Once a student is isolated, we ask them to log on to that health portal where your students have probably been going to upload their vaccine record cards. And we ask them to complete the COVID self-check and reporting form, which is abbreviated as the SCARF. And that form, if completed, will trigger a ping to both my office, the Office of Health Promotion and Wellness, and to our health service. The health service can then work with the student to arrange a medical consultation, and then, either say, sounds like allergies, maybe it's just a head cold, or if they see something concerning, hear about a potential exposure, maybe bring them in for testing at the discretion of the healthcare provider. Next slide, please. We also have other resources for students who are experiencing symptoms. Of course, the on-campus health service is a great first place to go. If it's closed or they're unable to be seen right away, we also have an after-hours nurse consultation line. The number is there on our screen. And if you'd like to take a screenshot or write it down, it's a great resource to have. It's free to all students whenever the health service is closed. And students, of course, are also welcome to visit their off-campus healthcare providers if they'd feel more comfortable doing so. All right, and then I think I will hand it over to Ben.
Hi, everyone. My name is Ben Mayos. I'm the director for campus living. I use he, him pronouns. And I'm going to talk a little bit about prevention, risk reduction, and support in campus living. Go ahead and advance the slide. Thanks. So as far as the upkeep of our facilities in campus living, we have daily enhanced cleaning and disinfecting of high touch surfaces. And so we're talking about bathrooms, we're talking about door handles, entries in and out, of our communities, different common areas and communal spaces that could be study lounges or kitchen areas. And then we also work with our facilities team to have a custodial response team that allows us to do some heavier additional cleaning in spaces if we find ourselves responding to a potential positive case in residence. That allows us to return that space in a cleaned and disinfected status back to the community for its use as quickly as possible. You can go ahead and advance the slide. New this year, looking back at this past year, is that we will be having visitors back on campus, and that includes visitors in residence. And as John indicated earlier, there are going to be some expectations for those who are entering into our halls, not just on move-in day, but throughout the year. Those visitation expectations are certainly going to ebb and flow along with public health guidance as things continue to be dynamic. But broadly, we'll be looking at being consistent with expectations for vaccinated and unvaccinated individuals that we'll be holding Lewis and Clark community members to. That includes staff, faculty, and students. There's also going to be a fair amount of responsibility placed on hosts, so those students living with us, to ensure that anyone visiting them is aware of what those expectations are. This includes asking them to have their guests registered prior to arrival so that if we need to engage in things like contact tracing, we have the information necessary to do that. And again, hosts are going to be held accountable for taking those steps. And so should we find that guests have either not been registered prior to coming, or they're not following the guidance that's pertinent to their vaccination status, it's going to be the hosts who are students here that we'll engage with through our accountability processes and student rights and responsibilities to ensure that in the future they're following that guidance. Go ahead and advance. And then we also will have support from campus living staff. So we'll certainly be collaborating with some of my colleagues that you've already heard from. We try to be proactive. During the beginning of the year, we will facilitate conversations among roommates and apartment mates. That is an agreement. It is not a binding contract, but it's a series of prompts that we find it's tremendously helpful for students to discuss as they kick off living together. We've recognized over the past year and a half, couple of years, that within that, we need to make sure our students are talking about COVID and cleanliness and visitation, and how that sort of wound up in some of the normal things they'd be discussing around having overnight guests, or when they're going to have busy times of the semester. And then we're there, even when those agreements aren't working out perfectly, we're there to provide conflict mediation, to address potential policy violations, and certainly to provide support after hours and during the weekends. There are campus living staff in each building who are on call after hours, and then for the entire campus. And we coordinate with AMI as well to provide meal delivery for students who are doing isolation and quarantine housing as well. So there's a lot of support in residence for your students. And that's it for me. And Margaret is up next.
Hello, this is Margaret Upton. I'm the Director of Health Service at Lewis and Clark. Just wanted to let you know about our services in general, and then I'll speak specifically a little bit about how we're managing things with COVID. All of our services are confidential, and they're open to all students, regardless if they have the student health insurance or not. Routine services that we have are evaluating and treating illnesses and injuries. We do physical exams for athletic, gynecological, work-related, or travel-related needs. We have laboratory services. We do some in-clinic testing, and we also refer out to Quest. Last year, we did acquire COVID-19 testing for rapid testing with the Abbott ID Now, and that was very helpful in identifying COVID positive cases quickly. We do administer allergy injections and other injectable medications. Prescriptions, we have a small in-clinic pharmacy for acute care problems. And we also e-prescribe to local pharmacies. The closest ones are Fred Meyer and Safeway, and that can be accessed via the PIO bus or public transportation. We have travel consultations and vaccinations for travel. We also do referrals off campus to specialists, radiologists, therapy appointments, that type of thing. Next slide, please. Our services for the fall of 2021 are altered a little bit. They were altered last year as well, but this year we will have telehealth visits continuing to be available, and it will be the initial contact for all sick visits and also for some well visits. We will have separate clinics for well and sick in-person visits. Masks will be required for all in-person visits regardless of vaccination status, and that is per an OSHA requirement. Our morning clinics, we are scheduling for well visits that are not COVID-related symptoms. And in the afternoon, we'll have clinics that would have symptoms that may be related to COVID. As I said before, we have COVID-19 testing in-house with a point of care test. We also will send out as needed. Billing for symptomatic and asymptomatic testing. Our billing strategy here, not just for COVID testing, but for all laboratory testing, we do not bill insurance. We will give the student an itemized bill that they can access on the health portal. They can submit that to their insurance carrier, and we'll make sure that they have all the codes that they need related for that. Pacific Source, which is our school-sponsored health insurance, does cover all costs related in the clinic. We will be having influenza clinics. Some will be in-house, and also that we will have an outside vendor come on site as well. Currently, our hours are going to be 8 a.m. to 12 p.m. And like I said, that will be for well visits or non-COVID type symptomatology. And also then in the afternoon, we'll have our sick clinic for students there. Our weekend hours this year, we will have Saturday telehealth hours available from 10 a.m. to 12 p.m. for at least this fall semester. We'll evaluate it spring later. Next slide, please. For our staff, we have 2 full-time nurse practitioners, 1 part-time internal medicine physician, 1 registered nurse, 1 laboratory technologist, and 1 administrative assistant. And currently, because of COVID, we've actually added 4 on-call nurse practitioners to help with staffing needs as needed. Next slide, please. On the health portal, as Ami had mentioned, students are used to this. We do have health histories that need to be completed, as well as immunization requirements, not only for COVID, but also for measles, mumps, and rubella. That is a state requirement. So your students should be familiar with that and should have that all completed before they come on campus. We will be using a mobile self-check-in process for appointments and our Saturday telehealth appointments, as I mentioned before. Students will be needing to do the SCARF form prior to being evaluated for either well visits or ill visits, because even if a student is scheduled for a well visit, we want to make sure they're healthy before coming in the clinic. Next slide, please. As mentioned before, we do have a nurse consultation line for when we are closed. There are some urgent care listings, and there's our website. And there are some of the Legacy, Providence, and AFC are some of our urgent cares that are close by. Oregon Health Science and University is our teaching hospital, and it is within 6 miles. So there's excellent care for students if they need hospital evaluation. Transportation for ill students, we do have a cab service that can be utilized if students don't have access to someone with a car to get them to a facility. We also have emergency medical transport if needed. Next slide, please. There's our contact information. Our website gives a wealth of information, and our phone number, fax, and our email. And that's all for me. I think Ami is up next.
Thanks so much, Margaret. So let's talk a little bit about isolation, quarantine, and what happens if we do identify a case within our student body. Next slide, please. So the big question, what if a student tests positive for COVID-19? Well, if a student is diagnosed with COVID, either via one of our surveillance testing clinics or by one of our on-campus medical providers in an individual test, Lewis and Clark Wellness staff will reach out immediately to support them into isolation, separate them from other folks, and then we'll work to help provide them with food, medical consultation, and also academic accommodations as needed during their isolation period. Then we'll initiate contact tracing and make sure that we're reaching out to other folks who may have been exposed to that positive case. The duration of the isolation period for the positive case is determined by health service staff based on a variety of factors, but students do need to be cleared by the health service before they end that isolation period. However, as long as that period lasts, they'll be provided with really hands-on case management and regular medical check-ins to make sure they have everything that they need to get through and out the other side. And you can advance the slide. Okay, great. So then the other side of the coin is, what if a student is exposed to COVID-19? So, at this time, CDC recommends that vaccinated people who are exposed to a confirmed case of COVID get tested 3 to 5 days after the exposure, then wear a mask indoors for either 14 days after the exposure or until they get a negative COVID test result. We also will ask the exposed students to keep up their daily health checks and immediately report any symptoms that develop using that SCARF form. A student who thinks they've been exposed can also use a SCARF form to report the initial exposure. We sometimes also find out that someone may have been exposed through that contact tracing process. As John prefaced this presentation with in the beginning, we will have near universal vaccination among students and staff at Lewis and Clark this fall. However, we do have a quarantine process in place for the very few students who have been issued an approved exemption from vaccination or who are still in process of vaccination when they arrive at Lewis and Clark. So for those unvaccinated students or not fully vaccinated students, if they are exposed, they'll be supported into their quarantine housing, separated from other students, and then provided with the same food, medical consultation, academic accommodations that a person in isolation would also be provided with. And then we also contact trace those folks to see kind of how big of a pool of potentially exposed students there might be out there, and then initiate immediate outreach to ensure that we are notifying folks and providing them with the appropriate next steps. Thank you. So on the topic of contact tracing, as I'm sure all of you are aware of at this point, the purpose of contact tracing is to identify people who may have been exposed to a disease and then give them the recommendations and resources that they need to avoid exposing others. So at LC, we reach out to a student who may have been exposed using a variety of means: phone, text, secure message in the health portal. I am known as a pretty tenacious contact tracer, and I pretty much use every means of contact at my disposal to make sure I'm talking to folks in a timely manner. And then we work with the students to collect relevant information about their health, recent activities, assess their risk, and then guide them through the appropriate next steps, such as quarantining or testing. We also identify areas of the campus that may have been contaminated and then initiate disinfection protocols as needed. These students who are involved in the contact tracing process are followed up periodically after the initial outreach to ensure they're receiving adequate support. And we also collaborate with Multnomah County Health Department to ensure that contact tracing is not only being enacted within our community, but also that folks are being notified who might not be affiliated with LC. We could leave contact tracing to the county, but we have this in-house contact tracing model that has really allowed us to respond far quicker than the county and really contain potential outbreaks. Last year, we typically initiated contact tracing within 2 hours or less of a case being identified. And I would really attribute our low case rate to that ability to take quick action and our wonderful students who have been really responsive and really looked after our community by cooperating with contact tracers. All right, I think that is back to John now.
Thank you, Ami. We've talked a lot about the medical aspects of COVID and also some other medical issues just in general in terms of support for students on campus. I mentioned that part of my role was Associate Dean of Students for Health and Wellness, in which case I oversee a number of the people on this call today. I work closely with the health service, closely with Ami and our public health folks. But I also serve in the role as chief psychologist, and so I directly oversee our counseling service on campus. And we know that these times are stressful times. They've been stressful for our students, some of our students for a long time actually. Just the stress of college, being on your own for the first time, navigating academic stresses, financial stresses, relationship stresses. Financial stresses, other stresses that they might be experiencing. And then we throw COVID on top of all that. So we know COVID has been, very difficult for many of our students. It has caused challenges for their families. Some of them have lost loved ones. Some of them have lost jobs. Their family may have lost jobs. They've had to move, or any number of financial and health and work stressors have developed for them. It's also been a time of reckoning for our country with racial and social justice issues. And we know that for our Black, our Indigenous students, our Latinx students, our Asian American, Pacific Islander students, it's been a time of greater stress. And so our on-campus counseling service is a really valuable resource for students. It will be available again this fall. We offer confidential, brief counseling on campus. It is free. We have some limited psychiatry services. Those are not free. Those have a cost associated with them, but the counseling services are free. This last year, we offered exclusively telemental health services. That went pretty well. We're eager to get back in the business of doing face-to-face counseling services. And our transition to going back to face-to-face counseling services will be guided by the best public health guidance that's out there currently in the state of Oregon to do face-to-face sort of counseling. The Board of Psychologists is requiring both clinician and client to be masked up. So sometimes that interferes with some of that experience of the counseling relationship when both people are wearing masks. So we will continue to embrace telemental health as a treatment modality, and we'll see how expansive the telemental health services are this fall compared to face-to-face. We're just sort of watching how things develop. We have both licensed mental health professionals on our team, many licensed psychologists. We also have a licensed clinical social worker. We also have graduate trainees on our staff. The staff this fall will have both a resident and a fellow from Oregon Health Sciences University. In addition to the direct services we provide to students in terms of confidential counseling, we also offer consultation to people who are concerned about students. Oftentimes a student will have a problem and I am not the first person on campus they go to chat with about their problem, nor are any of my counselors the first people students chat with. They'll chat with their friends, they'll chat with their family, they'll chat with other people. Sometimes they won't chat at all, they'll just sort of keep it on the inside. But yet people will notice things of concern. A student maybe who seems to feel depressed or have low energy or seems to be withdrawing, or a student who feels highly anxious and is really having a lot of panic or anxiety. So we offer consultation services by our trained clinical staff to faculty, to staff, to students, to family who are concerned about their student. And all of those can be accessed by calling the counseling service and asking essentially for a consultation. The counseling services that we offer are daytime counseling services essentially. After hours or in emergency situations, we have a 24-hour crisis counseling line. You can see the phone number there. That phone number is available both to students, and we market that number, but it's also available to family who might be needing a mental health consultation after hours or on a weekend or sometime when our counseling service is closed. So that's a resource for parents and family as well. In an emergency situation, our campus safety office is a resource. They're available 24/7, 365 at that number that shows on the screen. For situations that are a little bit less urgent, not an immediate emergency where one would be calling campus safety, but rather a situation of concern that's not an immediate emergency, we have a system called the Welfare Intervention Network on campus. This is a team of mostly staff, but academic representation as well. And if you Google Welfare Intervention Network on the Lewis and Clark website, you'll find the team, and you'll find actually a link to a reporting form where you can report a concern about a community member. Your students can report concerns there too. If they feel like there's someone who is heading down a very, very difficult path and might need some engagement, some outreach, some intervention. The team, the Welfare Intervention Network, will do everything we can to engage the student of concern and put the data points together and see if we can provide some support. And then finally, I wanted to mention a word about confidentiality, and this applies to all of our services. The health service, well, I should say it applies to all of our wellness services. So the counseling service, the health service, our health promotion service, which Ami will talk about here in just a minute, as well as our COVID services. All of these services in wellness are considered confidential services, and under Oregon law, our records are confidential. They're private medical records. So without a student's permission, we're not able to talk with a parent or family member, nor with anybody else really at the college about a student's confidential health information. So we take that very, very seriously. We know that if students trust us, they're going to tell us what they need to tell us generally. If they don't trust us, then they're going to hold information from us that it's not a good thing. So we want them to trust us and to be able to work collaboratively with us to support their health and their well-being. And so if ever you're reaching out to us, just know that we may be bound, if a student hasn't signed a release, to keep that student's information confidential. If we're working with a student and we think there's a reason why it would be a good thing for us to be talking with the student's family, we will be talking with that student about signing a release form so that we can engage their family. And then and working with that student really, really assertively in that direction. Ultimately, in many cases, it still is the student's choice though about whether they sign such a release form. So sometimes there are situations that arise where a parent wants to know something about a student, or a guardian wants to know something about a student, and we're not able to share information because the student hasn't authorized the release of information. So just a little bit about confidentiality and how that works for our team. Ami, I'm going to turn it over to you to talk a little bit about health promotion services.
Great, thank you. Yeah, so, in addition to our COVID response work, our case management, and our contact tracing services, Health Promotion Wellness actually manages several programs that were pre-existing before COVID and are designed to promote other aspects of health and well-being for LC students. So We host a sexual and interpersonal violence prevention and response program. We also offer the services of confidential advocates, who are folks on campus who are trained to respond to and support survivors of sexual and interpersonal violence. We administer EverFi, which is a substance abuse education module that students are required to engage with. We also host periodic health education workshops and trainings on different topics that are of interest to or relevant to the student body at the time. And finally, we also have lights for seasonal mood problems that can be really wonderful for students who maybe this is their first Oregon winter. So you can learn more about these services and find our contact information by visiting the Health Promotion and Wellness webpage at the Lewis and Clark website. And I think with that, I'm going to hand it over to Ryan Jensen.
Hello. Sorry, my video is not working. I am not here specifically to talk about COVID resources, but more, oh, there we go. COVID resources, but more food and how that relates to community and student health and wellness. I kind of beg to be added on to this because that's something that I tend to like to get in front of friends and families and let them know who I am and what resources we offer and how to get a hold of us if you have more questions. Go ahead, Henry. So really our philosophy around food service is based on sustainability, environmentally, but also very importantly with the community itself. We cook our food from scratch. We don't have secret ingredients. We have full traceability. We work a lot with local farmers and producers so that we can make sure that what we're providing is healthful and that we can answer any questions that people have about the food that they eat. We're living in a world where more and more young people are developing sensitivities and allergies and have more and more restricted diets. And that's going to be something that's important as we're providing the nutrition and the meals and really the family room and living room and dining room for your students for the next couple of years. While we do have many students that we interact with on a daily basis, we do try to work very closely with every student that comes to talk to us about their needs. And we've had a lot of success over the years working with individuals who thought that no one cared or thought that no one could help. We do solicit feedback and we love to talk to our students and find out, what their needs are and what their likes are and what we can provide to make dining a little more exciting or comfortable while they're here with us. One of the things that I find challenging, having done this for 15 years, is too frequently I find out too late that a student was struggling with something, that they had a challenge with nutrition or health or navigating our services or even knowing who to talk to. And as a group of people who are here to provide a service and to problem solve, that's sad to hear. So the one thing that I would ask as you're listening to your student about their first experiences here at Lewis and Clark is to encourage them to come and talk to us and advocate. The sooner that they will reach out to us and look for a solution to their challenges, the quicker we'll be able to navigate and find those for them. Go ahead. So I put together kind of a list of frequently asked questions over the years, and some of these are things that some of you might not have thought to ask, but hundreds of people have. So if your student is a picky eater, will they be able to find food to eat? We operate a number of dining venues across campus with different service styles. Some of them are more scripted and limited, and some of them are wide open, where students can really plan their own meals and select things. But again, if they're having challenges with that, have them come and talk to me or talk to our culinary staff. There are a variety of different meal plans. They're kind of based on a student's dining needs and schedule. Some of them are designed for people who want to eat every meal. Some of them are designed for students who are a little more independent. who are getting off campus or who like to sleep a lot and don't make every meal. A flex point, what is a flex point is a common question. That's declining balance dollar for dollar that's added to students' meal plans so that they can buy coffee, additional meals, snacks, pastries, maybe buy a friend or a visiting family member a meal. And you can add more of those on, your student can, or you can contact our office directly and we can help them out. We want to make sure that the students don't go hungry. Will the students find time to eat? We have a lot of students. And every student has a different schedule between academics and athletics and work. Tell them to come and talk to us if they're not able to get the time that they need. Most of the students will be joining us in Fields. You'll hear it called the Bone, but it is the Fields dining room. And again, we do have a number of other outlets across campus. The trail room will be open this fall. Our 2 coffee shops will be open this fall. So there will be plenty of opportunities for them to eat. Currently, based on models before any changes for Delta, we will be open for self-serve, all you care to eat in Fields dining room, which supplies maximum opportunity for students to kind of modify their meals and get together the things that they do want to eat, but that is always in flux, and we'll be advising the campus community if a change is necessary. And again, we're following along with campus policies as well as county, state, and CDC policies in terms of social distancing and mask wearing. We're currently at a lower level of requirements, but that's being monitored on a daily basis. So any best practices that do come out that affect the campus community, those will take effect in dining as well. And then finally, what's for lunch? We do have a website where you or your student can see what we're serving each day. If you're hearing that all we ever have is mac and cheese or cheeseburgers, that's probably not very likely. But the first thing you can do is check in and see it. Maybe you're coming for a visit and want to find out if you want to have lunch with us. So those resources are available. Go ahead, Henry. If you or your student need more information, I've put up on this slide my email address, our executive chef Palmer. Scott is our office coordinator and is the best person to get a hold of. All 3 of our emails there. More information about who we are and what we do and what our menus are available at lewisandclark.cafebonappetit.com. At the bottom of that screen, you can actually sign up, or you can encourage your student to sign up for menu mail, which will send a morning digest each day of everything that we have in all of our cafes and flag them for vegan, vegetarian, made without gluten, etc. We do have a mobile ordering app that allows students who have busy schedules to order their food ahead of time and then pick it up at whatever time they would like to. That's kind of cool. It's called Get Mobile, and we'll have more information for your students when they arrive. And then our general office number listed there, 503-768-7890. Feel free to give us a call if it's about food or not about food. We're here to support your students and to support you. We know that there are always a lot of questions, and food is important and community is important. So we're here to help where we can. And that's it.
Well, thank you, Ryan. Appreciate that kind of overview of what's up with Bon Appetit and how you're serving our students. We just have a couple of slides left before we throw it open for questions. I know there's some questions in the Q&A for a while now, so we will get to those. And if other people have developed, questions over the presentation time today, please do put those in the Q&A, and we'll be sure to get them to them in just a little bit. So I want to talk a little bit about health insurance. And first of all, I want to say I will just talk maybe 3 minutes today about health insurance. We do have a full webinar that we're planning tomorrow at 4 o'clock Pacific time about health insurance. So if you'd like to learn more about health insurance, we will definitely go into a lot more detail in tomorrow's webinar. So tune into that. We do require that all students at Lewis and Clark have health insurance. So it's important to attend to this issue. And we want them to have health insurance that works in the greater Portland area. So lots of plans provide coverage to providers in Portland, which is great. But transportation to getting to off-campus providers, particularly for our first-year students who don't have vehicles, can be kind of challenging. So what I've done here is I've put, if you're going to get off campus, there's some different ways you can do that. Let's say you needed to see a healthcare provider. You could use the PIO Express, which is our sort of express bus service to the downtown area. You can also use city buses. There's the TriMet website. So what I encourage families to do is to, as you're evaluating your own health insurance plan and determining whether it's going to meet your students' needs in Portland, pull up their sort of find a provider feature in your insurance plan, and see what the range of providers is available in Portland and see where they're located. And then if you want to, you can use the www.trimet.org. Again, that's the local/regional mass transportation website. And you can use the trip search feature to see how long it would take to get from campus to a particular provider's office. Point is that sometimes some provider networks are so restrictive that it's really a long bus ride to their provider offices. And for a student who's feeling sick, that's not the best thing. Of course, students can access our health service on campus, just as Margaret described, but for specialty care, for imaging, for things that we don't offer on campus, we think it's best if students do have access to a range of off-campus providers, and it's best when those providers are, fairly accessible to students and not too far away from campus. I'll mention also here a note about Kaiser coverage. Of course, we offer our student health insurance plan. That'll be the focus of tomorrow's webinar. And lots of students choose to enroll in the student health insurance plan. You can keep your own plan, another plan if you want to. Many students come with Kaiser coverage. Kaiser coverage is an acceptable alternative to our student health insurance plan. And so it does meet the college's criteria for being able to waive out of the student health insurance plan. But the Kaiser facilities are fairly far from campus. So you want to be careful about that, just that if your student should ever need care that's in excess of what we can deliver on campus, and if all you have is Kaiser coverage, they may have to go a long way to get that, and that may not feel the best when they're really sick. So that's something to keep in mind. In addition, if you have Kaiser coverage, you do need guest privileges in Oregon in order for your coverage to be, really work here. So you want to be sure and be in touch with your Kaiser contacts to make sure that your guest privileges are in place. I would encourage you, if you're going with our student health insurance plan, it provides great benefits in the Portland area. It also works across the country. If you're not going to go with our student health insurance plan, just be sure to research pharmacies, hospitals, and urgent cares that are in network with your insurance plan. This is what I did with my students when they were going off to college, my children, excuse me, when they were going off to college. I kind of looked at where their colleges were physically located, what pharmacy, hospitals, urgent cares were in some proximity to those colleges. And then I told my children as they headed off to college, if you need to go to a hospital or a pharmacy or an urgent care after hours, here are some of the ones that are in network with our insurance plan. So that can be kind of a nice conversation to have with your students about insurance before they leave. Also being sure that they have a copy of their insurance card when they leave is important. Students are automatically enrolled in our student health insurance plan. There is a significant cost to that. It's a great plan, I think, at a great price for the benefits it offers. But you can easily waive out of that plan, but you do have to waive out of the plan by September 13th. Otherwise, you do have to pay the cost for the student health insurance plan. So be sure, check out our student health insurance plan. If it's not what you want, then be sure your student waives out by September 13th. That is the deadline for the entire year. There are a few students who qualify for mid-year waivers, but there's not very many. So be sure your student has waived out if they don't want the coverage. There's our student health insurance website. And join us tomorrow for our webinar if you want more information about insurance. Next slide, Henry. So final thing, what can you do to help students prepare for this fall? Well, we encourage you to familiarize yourself with our wellness web pages that we've identified today, also with the COVID web pages that the college has, and to be sure your student has done the same. We really encourage you to support your student in meeting our pre-arrival requirements. these things like uploading the vaccination information and getting tested if they're not vaccinated, filing for exemptions, completing the educational module about COVID, these kinds of things that I talked about earlier. Students sometimes will forget things, they won't follow through. So just support them as best you can in meeting those requirements. That's important. If a student is symptomatic on day of move-in, once again, they will need testing. So be sure to be ready to support them around that. Help them pack. Those items that Ami mentioned earlier are very important for students to bring with them, and so remind students about those items. Be sure students' health insurance, as I just stated, meets the college's requirements. And if students are choosing a different plan, again, research the in-network hospitals, urgent care, and pharmacies that are near to campus. Help your student understand how insurance works a little bit, just in case they ever need any off-campus care. And of course, be sure that if they don't want the student health insurance plan, they fill out the waiver by September 13th. This next item on the list is really more about coming to Portland, and that is that we encourage parents and family to help students get set up with a pharmacy in Portland. We offer a very limited dispensary out of our health service. Really, for most students, if they need prescription medications, they're going to go, as Margaret said, to one of our local pharmacies. And so helping your students get established with a local pharmacy in Portland would be a very good idea while you're here in Portland. Or if you want to try to do that via distance, you can provide support to them that way too. And then finally, very important that your student have an emergency contact on file with the college. They're prompted to set that up. You can discuss with your student who that emergency contact will be, and encouraging them to follow through and get that set up with the college. Next slide, Henry. Great. So thank you for all hanging with us. I know that was a lot of material. It usually isn't that much material, but usually we don't have COVID to contend with. So I hope that information was helpful to all of you. We're going to now dive into some of the questions that you've posed. And give me a moment while I look at those questions. Ben, the first question that's been hanging here for a while is this question of, will students with exemptions be paired with vaccinated students in residence halls? And I wonder if you'd be willing to answer that, and perhaps I could talk a little bit about it too if necessary. But Ben, would you be willing to answer that one?
Certainly. Yeah, we use a number of factors to place roommates together, but this year, vaccination status is not one of the factors that we're taking into account as we place roommates together. This is something I know John can add to, but we certainly would have concerns about using vaccination status as a way to isolate students within our community into different pockets. What would you add to that, John?
No, that's pretty much it, Ben. I'm aware that we'll be a highly vaccinated community this fall, and there are some students who, for medical or religious or other reasons, just are not able to be vaccinated. So we really wanted to be thoughtful about how do we support the entire community towards emotional health as well as physical health. So in the end, the decision was not to segregate students sort of into pockets of vaccinated and unvaccinated, but rather to not use that as a factor in addressing housing assignments. I'm looking at another question here. Hold on just a second. So there's a question. I'm curious about the term brief that is being used in regards to on-campus counseling service. It was used early in the webinar. It was also used a few times as brief counseling in the open letter for new undergraduate students. Yes, so our counseling service on campus, the most common number of sessions for a student to come in is actually one. More students come in each year for one session than for any other number. And I believe that was also true in last year when we had our telehealth services available. But the average number of the average number of sessions that students come in for is actually 5. And so, so that's sort of typical. We do have a limit of 10 sessions for students over the course of an academic year. So we tell students that, if you're coming in with an expectation that you want sort of longer term therapy, that you want regular weekly sessions with a therapist over the course of the year, that you want more than 10 sessions, or that you want any sort of specialty care, for example, around an eating disorder or substance abuse or something like that, really the counseling service is not your best place. But the counseling service does help with referrals off campus. So for students who do want longer term care, we can assist with those referrals. Ryan, I'm seeing at least one question here for you. I'll read this one out. If students are on a 14-meal plan, can they go in for breakfast and also take some food out for their lunch later?
So depending on where they decide to dine for lunch, if students take their meals in Fields Dining Room, which is our all you care to eat location, they must consume everything within the dining room. If they would like to take their meal in the trail room and use a meal equivalency at lunch, that is available both to eat at that time or to take with them. But the expectation is they will get one meal for each meal that they use. So they can't come in for lunch and then grab food to eat later in the day. Our meal plans some of them do offer the flex point option, which would allow a student to go and get some snacks in the afternoon. And we aren't going to chase people down if they decide to make the healthy choice to grab a couple of pieces of fruit and walk through the door with them. So hopefully that answers that question.
Thank you, Ryan. Let's see, I see several questions here about health insurance. I will try to address those. Yes, so there's a question about OHP, which is Oregon Health Plan. So that is, or essentially Oregon's version of Medicaid. So the question is, is it a comparable plan? Is that correct? Yes, it is. So if students who have Oregon Health Plan can keep that coverage and can waive out of the college student health insurance plan based on their enrollment with Oregon Health Plan. If you have Oregon Health Plan, if a student has Oregon Health Plan and it's from a different part of the state, Oregon uses CCOs to deliver care. There's a lot of acronyms here, but Oregon uses coordinated care organizations, or CCOs, to deliver care to the Oregon Health Plan. Sometimes students from different parts of the state will have a CCO that doesn't work in Portland, really, right? And so what they'll want to do in that case is once they're here in Portland, they'll want to work with OHP to transfer their CCO to the Portland area. If they have questions about that, we have an email address for student health insurance. It's stuhealthinsurance@lclark.edu. You can also find that address on our student health insurance webpage. But students can get some questions answered about getting their CCO transferred. But basically, yes, OHP, when OHP provides care in the Portland area, it is a comparable plan. So we'll go into more detail about that tomorrow in tomorrow's webinar. Another attendee writes, we're waiting to hear back about whether or not our health insurance was accepted. How long should this take? So a student fills out their waiver. The waiver for, if a student is waiving out of the student health insurance plan, they'll need to fill out the online waiver. The online waiver went live on about July 8th. The online waiver is available on our student health insurance webpage. When you fill out the online waiver, you should get some sort of message that it was submitted and accepted. But ultimately, if you don't get such a message or it's unclear, here's what I want you to look out for. Look on the student's bill and look and see if there is a student health insurance charge that's still on the bill. Because when the waiver is processed, the student health insurance charge goes off of the bill, okay? So your the final word on whether the waiver has been completed or not is whether the charge remains on the bill or not. If you believe you've submitted a waiver and you've waited a number of days, let's say a week, and that charge has not gone off of the student's bill yet, I would encourage you to email that the student health insurance email account, stuhealthinsurance@lclark.edu, and our staff can look into your situation and see what's happening with the waiver. Another question about insurance to the pharmacies at Fred Meyer's and Safeway take the insurance offered to the school, and the answer to that question is yes. the insurance to the school, works very well in Portland, and also has a lot of portability to different parts of the US. Let's see. Gosh, I'm looking for questions. A lot of these questions, I think I'm probably in the best position to answer, so I'm going to keep answering them. There's two questions here about students. There's a question, how can students give parents waiver access for healthcare? I think that question is really about information access to what's going on with their healthcare. And there's another question about what forms must be signed or notarized prior to arriving on campus that will allow parents to access medical information on campus, FERPA or HIPAA. So I just want to acknowledge that there's two ways to approach this challenge about parents' access to students' information on campus. If some parents have taken the position that they want their student to sign a blanket release before the student arrives on campus or when the student arrives on campus to allow a parent access to the student's full medical record. The challenge with that approach is that sometimes students have private things that they want to talk with counseling staff about or with medical staff about. And if a student perceives that their parent is going to be getting into their healthcare when the student doesn't want it, sometimes students will actually not get care from our services. So I think it's a delicate line that I think really requires a conversation with you and your students as a prelude to signing any release forms. But if you've talked about it with your student and you're all clear that the student is satisfied with signing a release form that will allow you access to their medical or counseling information, then we do have release forms, and I'm trying to think about the best way to steer you towards those. They're on our website. I believe they're still there under the forms section, but they're actually probably the best way to do this. So the way we interact with students for the most part with regard to private health information is through our health information portal. And we do have some release forms available on the portal that students can submit online. So they can log in the portal and do that. But they're also available in places on our website as well. When you come to campus, those forms are available in our offices. So they're also possible to sign in person. So there's different ways that students can give family permission to sign those forms. The alternative to doing this in advance would be to wait and do it on an as-needed basis. As I mentioned, the advantage of doing that is that students will feel comfortable getting care from us because they will know that their information is confidential from everyone, including their parents and family, and that again, our staff will engage a student if there's a health issue going on that we think would benefit from parental or family involvement. And then oftentimes students will sign release forms at that point. So they don't necessarily do it as a blanket release before the fact, but they do it on a case-by-case basis after the fact. I see another question here about mental health services. Do some students start with counseling and psychiatry services on campus and then move to off-campus services? Right, we've been working to find a therapist off campus who it's not too difficult for a first-year student without a car to get to, right? So glad that you're being proactive and trying to take those steps. Yeah, some students do start with counseling and psychiatry services on campus. Again, if we have a sense a student really is looking for longer-term services from the get-go, we're going to try to start to refer them from the get-go rather than just kind of with this context that you can have your 10 sessions with us and then move off campus. So we're going to be assessing each student in terms of what their needs are, but our staff really are experts at helping students find referrals off campus. So if you're having difficulty finding referrals off campus, please be in touch with our counseling service. Our email is counsel@lclark.edu, and we can talk with you and or with your student about trying to find the best fit resources for you off campus. So, but students, yes, they can use us as a bridge to getting services set up off campus, especially first-year students. Let's see. I think we've covered all the questions. Oh, I see another question or two. Can we get the pharmacy's address, Safeway or other, to give to a PCP? The ones accessed by the PIO Express. Margaret, could you take that question on for us?
Sure. The addresses for the pharmacies, I think, are listed on our FAQ page on our website. But they are both on Barber Boulevard in Portland. So you can actually have your provider send things directly to them.
Yes, thank you. Thank you, Margaret. And how about this next question, Margaret, about are there limitations to what student health services can provide related to chronic conditions and also daily medications?
We do treat students that have chronic conditions. We'll work with them. We do have medications for asthma, and we will monitor them. Depression, we kind of work with both counseling with the psychiatrist as well as our internal medicine provider, and some management of that is handled with medication through us. Also birth control, we do offer birth control services here, and we can prescribe that for students.
Great, thank you, Margaret. I think we're down to the last question here. My student is going to apply for Portland Medicaid when she arrives. While we're waiting to find out, can she go to the campus health clinic for care if needed? So actually, just to underscore something Margaret said earlier, but this is a really important point, is that students can use our health service regardless of what their insurance is. They don't have to have student health insurance to use the to use the health service. So, absolutely, your student can use our clinic for the care that we offer. And if they need care that's beyond what we can offer, then we're happy to provide them with referrals off campus. And one other thing about people who are transitioning, if you do have Medicaid from another state and you're transitioning to Oregon Health Plan, we know they can take a little while to get that set up. We can grant students extensions on the waiver deadline of September 13th in order to get their Oregon Health Plan Medicaid coverage set up. So if you're coming to Portland and to Oregon from another state and you have Medicaid from that other state, then we can, and you're going to need more time than September 13th to get everything set up. That's usually the case. Then please reach out to our student health insurance program, and we'll be happy to talk with you about the possibility for extensions. Okay. Well, I think we've answered all the questions. It's been nice to engage with you all today. I really wish that you were here in person for this program so we could see your faces and feel your energy. But we are super excited to have your students with us this fall. And we hope we've done a good job of providing you an overview of our health and wellness services, also our campus dining services. We do have a lot of great, committed, dedicated staff at the college, and we're very committed to supporting the health and well-being and safety of your students this year. So best wishes to you all. We hope to see you on campus later this month for Parent and Family Preview. And I think that wraps it up. Take care. Bye-bye.